This is not an aesthetic case. This is the tooth that had fractured vertically. You can see that tooth had had endodontics, an apicoectomy, and a cast post. Today, we're extracting that tooth with the Easy Extract, number 7. So I'm measuring the length of the tooth to the apex just because I know how deep the socket is before I use the Easy Extract. Now, a great way to use the Easy Extract, if you can get some horizontal movement on the tooth, mesial to distal, with a 301 Hu-Friedi or some other instrument, that's nice to kind of loosen it up a little bit. Now, you don't want to move it with a forceps facially or palatally, because you want to preserve that facial bone and the palatal bone for the implant. If it's a single-rooted tooth, I would prefer to place the implant at the time of extraction. Why? The socket is there. The guide for the implant is there. If the tooth was located in the correct position, you've got a perfect little cylinder into which to place the implant. Now, if it's a multi-rooted tooth, I don't ever place the implant at the time of extraction. I graft the socket ideally with platelet-rich fibrin mixed with freeze-dried bone. I like to mix it with some freeze-dried bone because the platelet-rich fibrin is kind of like working with Jell-O. Freeze-dried bone gives it some stability, more like sand, but you've got the enhanced healing effect of the platelet-rich fibrin, and the platelet-rich fibrin serum is used to mix with the freeze-dried bone and the cut-up pieces of the platelet-rich fibrin. So see, I'm trying to get just a little bit of mesial distal movement on that lateral incisor. Just makes it easy if you've got a little movement to extract it with the Easy Extract. So I'm now why am I reflecting this flap? I want to see the alveolar crest, because when I place the implant, I want the coronal part of the implant to be at the alveolar crest. So you can see there's the alveolar crest. I'm removing the filler, the temp provisional material from the orifice of the lateral incisor. I'm drilling down to the endo. So there's 3 drills with the Easy Extract. Now, sometimes I'll use either a pilot drill to drill to the apex of the tooth. And what I'm trying to do, I'd like to go a little past the apex of the tooth. So you can see this tooth is about 10 millimeters, and I end up placing a 14 millimeter implant. That's because it stabilizes with the apical part of the bone. If I go past the tip of the tooth just a bit. So this I've marked at 10 millimeters. You'd like to see I drilled just past the tip of the apex. This is the first or second drill. Then there's 3 different widths, 3 different diameters, and each of them I drill to the same depth, all of them about 10. Then you've got different widths of these screws that you screw into the orifice that you've drilled into the tooth. So you want these to bind, so you have to use the ratchet wrench to screw it in. And you want to screw it in, you want to flatten the coronal part of the root so that this screw screws flat with the coronal part. Okay, so I felt like this screw was a little bit loose. It didn't bind as much as I wanted it to. So I went to the next width screw. I'm screwing this one out, and now I'm screwing the next width screw into the tooth. And I want it to bind at least when I use the ratchet wrench. If it's too loose, it'll pull straight out. So the key is you want that shoulder to be, if there's much tooth, if it's kind of a jagged coronal part of a tooth sticking above the gingival line, you want to flatten that so that the shoulder of the screw is flush with the flat coronal part of the tooth. Try this in the tray, and before you put the fast-set polyvinyl siloxane in the tray, try these teeth in the extractor to be sure you've got the tray seated so that there's not too much space. You want this to kind of squeeze in between the shoulder of the screw and the tray. You don't want a lot of space in here because this is going to open. So you want that to just barely squeeze in there. See how much space you've got, and then put the facet polyvinyl siloxane in the tray. Don't push that all the way down. Just get it going, then put the teeth in there and seat it only where this is just barely able to squeeze into this part between the shoulder of the screw and the tray. Notice if you push that tray all the way down and there was a big gap in here, so that there was a gap between the teeth and this part of the screw, then it won't extract the tooth, because as you torque this part of the extractor, there's too much space till it connects and starts extracting the tooth. So you want to just barely get these teeth between the shoulder of the screw and the tray. Don't push the tray all the way to place. And then let the polyvinyl siloxane set up, and you start screwing this, and this extracts the tooth vertically. Now, it's not a bad idea to put pressure on this part so you can feel the torque on the tooth, and just leave it for a while. Maybe go check a hygiene patient and come back in, and sometimes the tooth will be extracted just from that slow pull. I try not to go straight to completion of screwing this part and torquing it straight out. I want to give it some time to release. So this is the moment of truth. You know, either the threads have stripped through the tooth and the screw has pulled out of the tooth if there was decay in the tooth or something, or the tooth is extracted when you can screw this and there's no tension. So fortunately, in this case, and most of the time, the tooth has been extracted. So you can see I've performed an apicoectomy on this tooth, or somebody did years ago, and there's the tooth. So I'm reflecting this tissue so I can see the alveolar crest. Hello, this video is a small portion of a complete comprehensive video. If you'd like to see this complete comprehensive case and many other complete comprehensive cases, click on the link in the description below. That's the Dental Minute. These techniques work, and they work every time.
Are you ready to take your dentistry practice to the highest level possible? Of course you are! Subscribe right now to dentistrymasterclasses.com, where you will get Dr. Cutbirth's greatest work and best cases. Here's what you're going to get when you subscribe to dentistrymasterclasses.com. Incredible comprehensive cases not seen in Dental Minute videos. You will get an organized library of all the Dental Minute videos and Dentistry Masterclasses, comprehensive cases for study and reference, before and after photos of Dr. Cutbirth's fantastic restored cases. And all of this, I repeat, all of this is just $40 a month. This is something you cannot pass up. Subscribe right now to dentistrymasterclasses.com.